Before I get to the latest numbers, I want to clarify what the isolation requirements currently are in Alberta and when they begin, as I've heard some questions on this topic. If you have COVID, the greatest transmission risk is in the few days before and after symptoms start, but it is still possible for some people to transmit the virus and infect others for up to 10 days. That is why if you are not fully immunized, you must isolate at home and away from others for the full 10 days. If you share a home with others, you should isolate away from the rest of the household, and at minimum should wear a well-fitting medical or 3-layer cloth mask if you were in the same room as others at any time. If you were fully immunized with 2 or 3 doses, you must isolate away from others for at least 5 days from the day you were first symptomatic or tested positive. That is considered day 0. On day 6 after the onset of symptoms, counting from that day 0, or the 6th day after a positive test result, if your symptoms have resolved, you're able to leave your home but must complete the rest of the 10 days of isolation by wearing, at minimum, a well-fitting medical or 3-layer cloth mask at all times. This means that in this time period, you are not able to remove your mask to eat or drink with or near others. This is important to mitigate the transmission risk in this second part of the 10-day period. After that full 10 days have passed, you no longer have any specific isolation or masking requirements over and above the public health measures in place. I also want to provide some clarity for Albertans who have recently tested positive for COVID-19 on when they might need to contact their family physician. This will help save time for those with COVID and reduce unnecessary calls to busy clinics. If you have a positive test result, you do not need to contact your family doctor with the results unless you are at high risk or experiencing moderate illness or symptoms. If you're not sure what level of risk you're at, the Alberta Medical Association has a reference document on their website that can help you assess this. If your risk is moderate to high, you should contact your doctor's office and advise them of your situation so they can help determine the best treatment path for you. If you are in this group and want to share your rapid test result with your physician, you can complete the form available on alberta.ca and submit that along with a photo of your rapid test to the clinic. This reporting is optional, but may be important or helpful to some individuals. I've also heard that some Albertans think they may need a doctor's note when they have COVID to be eligible for certain benefits or for sick time at work. However, in most cases, you do not need one. If you were applying for the Canada Recovery Sick Benefit or the Canada Recovering Caregiving Benefit, a note is not required as long as you meet the eligibility criteria. If you contracted COVID-19 in your workplace as a result of your regular job duties, you may be eligible for coverage and support through the WCB. They accept a positive PCR or rapid test result or a doctor's diagnosis as part of their claim process, so a doctor's note is not required if you have a positive test result. Due to the rampant spread of Omicron, we ask employers not to require individuals with mild symptoms to get a COVID-19 test or doctor's note to be eligible for sick time off work. Instead, please support sick employees at this time of high transmission to stay home with no testing or doctor's note requirements. Some patients have requested a doctor's letter to help facilitate some aspect of domestic or international travel. But doctor's notes are generally not required or warranted for travel purposes. It's most important that anyone planning to travel is fully vaccinated and has proof of their vaccines. I hope this information is helpful for those who might be wondering when to call their doctor about COVID. Turning to today's numbers. Over the last 24 hours, we have identified 3,218 new cases of COVID-19 and completed about 9,350 tests. Our positivity rate for lab-confirmed tests is about 34.7%. As you know, due to the rapid rise of the Omicron variant, we adjusted PCR testing eligibility a few weeks ago to ensure those who have clinical risk factors for severe outcomes and those who live or work in high-risk settings can get tested and receive their results in a timely manner. We continue to monitor this approach closely and evaluate the capacity of our labs. At this point, we are able to meet the demand for all these high-risk individuals in a timely way, and we have the opportunity today to introduce a small change to PCR testing eligibility. Effective immediately, children under the age of 2 are again able to get tested for COVID-19 through AHS assessment centres. This is a pragmatic approach, since rapid tests are currently not licensed for use in children under the age of 2.
We continue to see the positivity rate come down slowly, and certainly the total number of active cases. Our wastewater data is trending down in 14 of the 18 communities that we monitor, so that continues to be the same case as last week. And most importantly, we've seen significant declines in the trends in Calgary and Edmonton, where Omicron started first. ICU numbers for COVID have been trending down as well a little bit. We have today 106 COVID patients in intensive care and 194 patients in intensive care overall, COVID and non-COVID. Worth noting that 28% of the 106 COVID patients in intensive care are incidental COVID cases. They tested positive, but they're not there because of COVID. It is we're grateful to see that because of the lower severity of Omicron, a large part of which is because of higher vaccination rates, we have seen much less impact on our intensive care units. Now, in terms of non-intensive care acute care beds, we currently have 1,363 COVID patients, or I should say patients with COVID in hospital. 40% of those are incidental. That is to say, they were not admitted to hospital because of COVID, but they've subsequently tested positive. So now that number has gone up over the past week or two. And there is real stress in the system. We see particular stress in some of the large urban emergency wards. And there is continued need for Albertans to be cautious, careful. Please continue to follow the public health guidelines and measures. And please, if you have not yet done so, get your booster shot. I understand that today Alberta Health Services did open the pandemic response unit in Edmonton. I described our preparation for this work last week. So this is a kind of overflow capacity for patients who are close to being released from hospital, but they may need some ongoing monitoring and some ongoing health support